Okay, hi there, everybody. This is Kim Hansen speaking. I'm the Director of Federal Affairs with Diabetes Canada, and I've also been leading the project to develop the Diabetes 360 strategy. I'm really grateful to all of you for being here tonight, and I'm looking forward to having a chance to share with you our Diabetes 360 recommendations, as well as some suggestions for ways that you can get involved in advocating for Canada to adopt a strategy for diabetes. I'll also save some time for questions toward the end of the hour. Just a couple of housekeeping items before we get going. I wanted to let you all know that I am recording this webinar so that I can share it with others who weren't able to be here tonight. And I also wanted to let you know that I have muted all of your lines just to minimize any background noise, but I will be unmuting them and will let you know how you can ask questions when I'm finished with the core part of the presentation. Hope that's okay with everyone. So, as you know, Canada is facing a significant challenge with respect to diabetes. Diabetes has been getting far worse over the last 40, 50 years, and it shows no signs of stopping. Right now, diabetes is costing our healthcare system $27 billion a year, and at the rate that diabetes is growing in prevalence, that will top 40 billion within about a decade. It's also hurting millions of Canadians. It's causing many, many debilitating complications, and it's really something that we have to do something about. And so Diabetes 360 is a strategy to address that. I apologize, someone sent a question, which I appreciate. I should mention for anyone who's listening in just on their phone line that you can access the presentation that I'm reviewing by visiting our website, www.diabetes.ca/strategy, and click on the file that says Tips for Advocates. That's the presentation that we're reviewing. You'll also be able to access a toolkit for advocates there that you can access. Someone's asking what the telephone number is to dial in, and just one moment and I'll get that for you. Sorry everybody, please forgive me while I get that information. The number is 1-844-614-2115. Access code 612-258-80. All right, so continuing on, diabetes is something that we have to do something about. It's also an illness that really adversely affects people who are already dealing with other challenges often in our country. For example, there are people from certain ethnic backgrounds, such as people of African background, of Latin American background, of South Asian or Asian backgrounds, who are more susceptible to developing diabetes. Indigenous people in Canada have a particularly high prevalence of diabetes and challenges in accessing quality care that mean that they also face much higher rates of complications than non-Indigenous people. So this is really something that is unacceptable and that we have to address. And part of the reason why diabetes is getting so much worse is that we've been without a dedicated diabetes strategy in Canada since 2013. Certainly some provinces have strategies, but there is no coordinating framework, there is no collective mechanism for collaborating among provinces and territories and federal actors to work towards goals. There are no goals that have been articulated. And what's more, there's currently no way of measuring the size of the diabetes burden in Canada, let alone our progress towards reducing it. Diabetes 360 is a strategy that was developed in order to ensure that we can do all of those things, that we can work in collaboration with provinces, territories, private industry, advocates, NGOs, and the federal government to collectively work towards improving patient outcomes. And I'll talk more about that in a few moments. Diabetes 360 recommends 4 targets. We recommend that by a certain point in the future, and it will be for the government to determine when that should be, we want to see that 90% of Canadians are living in an environment that preserves wellness and prevents the development of diabetes. Right now, we live in an environment that promotes obesity, other chronic diseases, including diabetes. And so we want to take some measures to reduce that prevalence by improving the environment in which we all live and preventing people from developing diabetes in the first place. Then we want to see that 90% of Canadians are aware of their diabetes status. Right now, there are about 1 million people in Canada who have diabetes and yet don't know it. And then there are another 6 million people or so who have pre-diabetes, many of whom don't know that. If we can make people aware that they are living with pre-diabetes or diabetes early enough, we can do a lot to prevent them either from developing the disease or from developing its complications. And so it's really important to increase the degree to which Canadians are screened for their risk of diabetes and aware of their propensity to develop it. The third target area is that 90% of Canadians living with diabetes should be engaged in appropriate interventions to prevent either, if they've got prediabetes, to prevent them developing type 2, or to prevent them developing complications if they're already living with any form of diabetes. Appropriate interventions doesn't just mean trips to the doctor or the nurse or the endo. It means a variety of supports, including supports for self-management, including community-based supports, including paramedical support providers, and everything that goes into managing a disease that, as we all know, is complex and multifactorial. All of these three first targets are driving towards the fourth target, which is that 90% of Canadians who are engaged in these interventions should be achieving improved health outcomes. And those are health outcomes both in terms of their average blood sugar, say, or their blood pressure or their lipid profile, but it's also in terms of how they feel, their sense of well-being. So Diabetes 360 is a framework for achieving these targets, and it recommends a number of actions to achieve these targets that I'll come back to in a few minutes and share with you. The reason why we are so excited about Diabetes 360 and why we believe that it's really a strategy that the government should adopt is because it's different from the one that we had the last time, and which was rather criticized by the Auditor General for not delivering results. Diabetes 360 has been developed based on a model that was used with extreme success for the community of people with HIV/AIDS globally. In 2014, the UN AIDS organization adopted a 90-90-90 target, and so those 90s from the last slide might sound familiar. That target was embraced by many countries around the world and really helped to galvanize the global community around solving the HIV/AIDS epidemic, and in terms of driving towards a common goal. In their case, it was reducing people's viral load to a certain level when they had the virus. And that really helped them to minimize the rate at which the disease was spreading and the rate at which people were going on to develop AIDS and suffer in consequence of that. So we've taken the lessons from the UN AIDS approach. We actually were lucky enough to have one of the engineers of that approach on our advisory board guiding us through the development of this strategy. And so we're able to learn lessons from them and take a page out of their book. That's why this strategy, compared to others that have gone before it, has a greater focus on primary prevention, so really on trying to minimize the number of people who go on to develop type 2 diabetes in Canada wherever possible, on increasing screening and early diagnosis so that, as I mentioned earlier, we can reduce the rate of diabetes and its complications, on increasing the accessible care. We know that many Canadians are struggling to get access to quality care in a timely fashion for their diabetes, and we think that there are a lot of things that we can do to make that quality care much more accessible without increasing the cost burden to our healthcare system. Finally, and I think most importantly, Diabetes 360 is really about measurable outcomes. So everything that will be designed and implemented under the auspices of Diabetes 360 will be set up and evaluated in terms of its overall impact on improving patient outcomes in a way that we can quantify. And if an intervention or a program isn't helping to improve patient outcomes, then it needs to be improved or adjusted or perhaps even sunset in favor of something that will. So this is all about driving towards improving the health and the well-being of people living with diabetes or at risk of it. We believe that Diabetes 360, if implemented, will really confer a lot of benefits to Canadians and to Canada. We're asking specifically that the federal government put in Budget 2019 a provision for allocating $150 million over 7 years to creating a partnership or task force that would implement these Diabetes 360 recommendations. There's currently no body within government or private sector who has a mandate as broad as what we're proposing, and other diseases such as cancer and mental health have really benefited from national task forces or partnerships that have focused on really pulling together all of the many counterparts that are involved in the healthcare system to implement change. So that's what we're proposing for Diabetes 360. We think it'll cost $150 million. It should take about 7 years, and then we want the partnership to sunset itself, having implemented these programs into the provincial and regional healthcare systems and into private sector to the greatest extent possible. We believe that in return for that $150 million investment, government can expect to see, at a bare minimum, $9 billion over those 7 years, just in cost savings from treating the people who will not develop type 2 diabetes by virtue of this strategy being implemented. There will be 770,000 fewer cases of type 2 diabetes diagnosed in Canada over the 7 years that this strategy is implemented, if it's followed the way that research shows it can be effective. There will be 245,000 fewer hospitalizations, each of which cost about $6,000 on average. So a sizable cost savings there, as well as a big improvement to human health. And 35,000 fewer lower limb amputations. So it's a kind of almost a no-brainer, honestly. We can't continue to allow the problem of diabetes to grow at the almost exponential rate that it has been in recent years. And we can see benefits in terms of costs to the healthcare system and to our economy, and more importantly, to Canadian citizens. We think that the government should take this on now, because this is a highly relevant issue to voters. Right now, we know that 5 million Canadians know that they have diabetes, and there are, as I mentioned, at least another million who have it and don't know it, plus 6 million people living with prediabetes. So that's 1 in 3 Canadians currently living with either prediabetes or diabetes. And all of them have family and friends who know them and see that they struggle with it. So there's really not a Canadian who isn't touched directly or indirectly by this epidemic. We also know that there are populations who are particularly susceptible to this disease, whose needs we need to care for. We have a growing population of seniors. Seniors are particularly at risk of developing type 2 diabetes. We have to find ways to provide them better care and help prevent them developing it. Similarly, there are many, as I mentioned previously, particular ethnic groups that are particularly susceptible to diabetes that need support. We think that this will generate a big return on investment, and I'll show you a little bit more about that in the next slide. So this shows this slide is slide 13 of 24, and it shows the blue line is the healthcare savings that can be derived just from preventing in this case over 10 years, preventing 1.1 million cases of type 2 diabetes. So this is based on some research that was done in Canada that looks at what the average cost of treating a person with diabetes is every year. And so you can see that out over time, the more we prevent cases of diabetes developing, the more the savings to the healthcare system accrue. If you then improve the care that people with diabetes are provided and avoid those hospitalizations and those amputations I mentioned a minute ago, those savings grow to that green line, and that's significantly higher. So it's about $18 billion in savings to the healthcare system over 10 years. The yellow line shows savings to employers. Based on some research that was done by Benefits Canada, they estimate that an employee with diabetes on average costs their employer about $3,000 more a year than an employee without diabetes. Those costs are associated with reduced productivity and with additional benefits costs. And so the savings over 10 years to Canadian employers, if that 1 million people don't develop diabetes, are another 18 billion, for a total of 36 billion over a decade. It's a lot of money, and more importantly, as I've said before, a lot of suffering that's avoided. So these are the recommendations that we have made. You'll notice on slide 15, we start with recommendations on the categories of prevention and screening. So again, vis-a-vis the target that we have for preventing people from developing type 2 diabetes in the first place, we're proposing 5 actions. So the first is that we really think we have to go back to the basics and eliminate health inequities and food insecurity. Research has shown categorically that people who are lower income or living with food insecurity are particularly susceptible to developing diabetes. They're particularly constrained in their ability to treat it effectively, given how important access to a healthy, balanced diet is to living well with diabetes or reducing your risk of getting it. And therefore, they suffer more from the complications than higher income Canadians, and that's just not right. So we want to, as part of Diabetes 360, collaborate with community food cupboards and other experts in addressing poverty and food insecurity to really tackle that. We want to make healthy options always available to Canadians, and that's a suite of actions that ranges from making hydroponic gardens or greenhouses available in northern or remote communities so that they can have fresh fruits and vegetables readily available to them, all the way down to making sure that our community recreation centers have healthy options in the vending machines and not only candy and soda. We want to make sure that physical activity is facilitated, and we were fortunate to have Participation involved in developing this strategy, and we can really leverage their expertise in helping get Canadians moving, starting from school kids all the way up to adults. The government recommends that we all get at least 150 minutes a week of moderate to vigorous physical activity, and so we have to support that and find ways to ensure that for all Canadians to protect their health. We think that an important aspect of that is ensuring that healthy living is taught from a young age for all kids. We want to set kids up with the knowledge and the healthy habits that can last a lifetime and that can also influence their families, who can benefit from some healthier habits in some cases. So we think that by implementing quality education and healthy living consistently across all provinces and territories, we can really help to prevent diabetes in many cases. And then finally, we need to make sure that we continue to support the necessary research into all aspects of diabetes, including but not limited to prevention, treatment, and a cure. The second target area I had mentioned is screening. So in support of the goal that 90% of Canadians should be aware of their diabetes status, we want to take measures to ensure that people in Canada are screened according to the clinical practice guidelines. There are guidelines in place that are followed by many healthcare providers in Canada for the care of people with diabetes or for screening for diabetes. And yet, we know that not every Canadian is being screened according to those guidelines. Currently, there are significant gaps, particularly in some places, where screening is just not being performed as often as it would be beneficial for the citizens for them to be. So we want to do things like put reminders in the electronic medical records that doctors consult when they're seeing a patient to encourage them to remember to screen a patient who meets the eligibility criteria for diabetes. We also want to make it easier for Canadians to get screened by making screening available where Canadians are. So we'll look at implementing programs such as screening in pharmacies. We can go and get our vaccinations there now. Why shouldn't we be able to get screened for the risk of or presence of diabetes by a pharmacist? Also, perhaps grocery stores or community centers will look into different options and research and implement programs that make it easier to get screened. And then finally, in support of this target, we need to end stigma. And I want to really emphatically say that we know that ending stigma is a critical predicator of all of these targets, not just of the screening target. But we listed it here because we know that stigma and the fear of living with the stigma associated with diabetes can be something that prevents some people from even getting screened for the risk of living with diabetes, and that's got to change. Looking at the next slide, our actions under treatment are that care should conform to guidelines. So right now, even once somebody has been diagnosed with diabetes, there are clear guidelines around certain tests that should be performed every year in order to monitor their risk of complications. Those aren't being consistently performed. And so we can definitely, again, link to EMRs, send out reminders to healthcare providers to ensure that care is more in keeping with the clinical practice guidelines, which are all based on best practice global research. We want to make sure that patients get the right treatment at the right time. And in some cases, that might mean referring up to a specialist, but in other cases, that might mean redirecting someone from a visit to a specialist and instead sending them to a nurse practitioner who can provide them the care that they need at that point based on their situation. We also think that we can do a lot to leverage telehealth and e-health technologies in order to make care available even to Canadians who are living in remote or rural settings. And you can actually now even screen for the risk of diabetic foot problems or diabetic eye problems using an iPad and an internet connection. So we can do a lot to make care more digital, more virtual, and therefore more available to all Canadians. We also want to make lifestyle medicine programs available to all Canadians. These kinds of programs, which involve ongoing coaching and advice about nutrition, exercise, as well as the mental and emotional aspects of living with diabetes, have been shown to reduce the risk of someone with prediabetes going on to develop type 2 diabetes by 60% almost. And so this is a really huge benefit. It's working in many centers globally. It's proving results over and over again. We need to make that available to all Canadians. And in this day and age, it can be done using an app on people's phones and FaceTimes or what have you. And so it doesn't need to require a big healthcare infrastructure for it to work. We also recognize the ongoing need to continue to improve the access of people with diabetes to drugs, devices, and technologies. This is a big category. There are many, many meaningful drugs, devices, and technologies that people with diabetes require in order to care for their health and protect it over the long term. And there are too many barriers in many places in Canada to accessing them right now. So we recommend a number of steps to continue to break down those barriers and ensure that everyone has the tools that they need to manage their diabetes well. And speaking of which, we need to make sure that patients are supported in managing their diabetes with resources that help them with the self-management part of it, with community-based resources. We'll create a repository of links to local cooking classes or community groups of people with diabetes that might help them to live more comfortably with the disease, help them learn what they need to learn, connect with their community, and won't necessarily impose a larger burden on the healthcare system. So just by coordinating those resources and putting them at the fingertips of people with diabetes, we think we can really help make it easier for people to treat and live with diabetes. All of the above measures, as I mentioned before, are aimed at improving the health of people with diabetes or at risk of it. And so this will mean reducing the sharp increase in rates of diabetes that we're seeing now. We want to see that people who have prediabetes or diabetes are experiencing, generally speaking, a lowering of their average blood sugars, an improvement of their lipid profiles, etc. We want to see a reduction in the rate of complications. Right now, diabetes is a leading cause of heart disease, blindness, stroke, kidney failure, amputation. That's got to change. The rate at which people are experiencing those complications needs to come down. And importantly, we want to work towards a goal that people with diabetes are reporting an improved sense of well-being. It's not enough that we reduce people's blood sugar if they're feeling worse. We have to improve their sense of overall well-being even while living with the disease. In order to support the above actions, we recognize that there are a few foundational elements that need to be put in place. I mentioned earlier in this call that we currently don't have any good system by which to even quantify the burden of diabetes. We can't actually even tell you today empirically how many people living with diabetes in Canada have type 2 versus type 1. So there's really basic gaps in the availability of data and information about the burden of diabetes, and we have to create that repository so that we're able to understand how various interventions that we'll take under this strategy, how they have an impact in reducing that burden. So we'll build a national diabetes repository. We'll make sure that we keep in mind the use of a value-based approach. And what that means, it's reference to an approach that was recommended by a professor out of Harvard. Essentially, it's an approach for redesigning healthcare models all towards improving patient health. So instead of a measure that it looks at driving cost out of the healthcare system, which doesn't often get us good care and most often causes more problems than it solves, this approach looks at driving towards improved patient health in the most efficient and effective way possible, recognizing all of the different factors controlling the healthcare system. There's currently a pilot going on in the Greater Toronto area where the World Economic Forum is looking at implementing a value-based healthcare approach for people with type 2 diabetes. And so we're working closely with that pilot to learn from it and to implement its lessons in our approach. Similarly, this approach needs to take a continuous improvement mindset. It needs to not spend 10 years planning and analyzing what it will do, but it needs to get started doing things that are supported by evidence and then continuously monitor whether they're driving towards improved patient outcomes and improve them if they're not. So it's got to be about a launch and learn kind of mentality. And then finally, it needs to continuously integrate best practices from around the world. We were really fortunate as part of the work that was done to create the Diabetes 360 strategy, which really benefited from the involvement of 120 experts from across Canada and around the world. We were very, very lucky to hear what best practices were in other countries and to benefit from them and to keep on the current edge of leading research and how things are evolving in the care and treatment of diabetes. And that has to continuously be baked into the approach moving forward. As part of our consultations over the last year, we had the chance to do a bit of a deeper dive on the specific needs of two of the subpopulations of people living with diabetes. And that is not because these are the only two by any stretch of the imagination, but they were two that we wanted to dig a little bit deeper in and to explore whether the recommendations that we were proposing that I've just described to you would be relevant to these two subgroups. So the first is people with type 1 diabetes. And by and large, we were really pleased to hear from them that the recommendations did resonate with them as being the right way to go. And they had a couple of qualifiers or modifiers. So for example, as we all know, there's currently no known way of preventing type 1 diabetes from forming. And so the primary prevention category doesn't have the same impact for people with type 1 of turning the disease off at source. But instead, research into the underlying mechanisms causing type 1 diabetes and therefore its prevention would be a really meaningful action under that target area for people with type 1. Similarly, under the category of treatment, there are certain technologies that people with type 1 are more apt to use than the majority of people with type 2. So those are really priority actions for that community, as is improving the care that young adults receive when they're transitioning out of pediatric diabetes programs and into adult diabetes programs, which are not historically have not been very well geared towards addressing the needs of people with type 1, where they're different than those of people with type 2. We also looked at the unique considerations of Indigenous peoples. We were very grateful to have an advisory group on the inclusion of Indigenous peoples who were there to guide us on ensuring that the recommendations that we set up were benefiting from the wisdom and the experience of Indigenous peoples, and that the framework that we created would be most amenable to Indigenous groups or nations electing to embrace it for a strategy for themselves. And so some considerations that needed to be borne in mind, and I think are reflected in the recommendations that we've talked about, are that it should address the health-related calls to action in the Truth and Reconciliation Commission's report, that we should prioritize both health and wellness, spiritual, mental, emotional wellness, not just physical, that we need to really tackle the social determinants of health in order to combat the epidemic for Indigenous people, and that we ensure that cultural safety and responsiveness is borne in mind at all times when developing a strategy and rolling out programs. And so that's really important guidance that this Diabetes 360 strategy reflects. So the plan, as I mentioned, is we're asking that the federal government implement and resource a partnership or task force to implement Diabetes 360 in Budget 2019, which should come out in late February or early March. We are really hopeful that they will do that, because that would allow the partnership to start doing its work and start to demonstrate some real tangible results in time for the 100th anniversary of the discovery of insulin in 2021. And we'd really like to be able to celebrate that milestone by saying Canada has resumed a position of leadership globally in the treatment of diabetes by embracing a strategy that was developed based on best-in-class public health practices around the world, in consultation with 120 stakeholders from 100 organizations across Canada, in collaboration with the community of people living with diabetes. We were so fortunate to have 30 patient advocates as part of the working groups and advisory committee that have developed these recommendations. So it's really, I believe it's a very well-developed strategy, and it's time for the government to embrace it. And so that's what we're pushing for. And our focus for the balance of 2018 is really on building momentum and making the case to the federal government that they can't go wrong putting this in budget 2019. So this is where it comes to you and why we need your help. And really, this slide just basically says, I'm on slide 21 of 24 for anybody following along on the phone, that politicians and policymakers are really motivated by personal stories. They love to hear real life stories from their constituents about issues. And so if you speak up to your elected officials and tell them why a diabetes strategy would be meaningful to you, it is worth 100 times of me saying it, being from Diabetes Canada. We know that there's strength in numbers, as always. And so we're going to be taking a lot of steps in the next few weeks to get as many Canadians as possible engaged in speaking up for this strategy, so that when there's a certain number, when there's a critical mass of people saying, we believe in Diabetes 360, it's time for Canada to have a strategy, it makes it impossible for the policymakers to avoid it. And we also recognize that there are a lot of diseases that people rightly need to be focused on addressing. And we need to make sure that our voice is also heard. Diabetes is an epidemic that is out of control, and it needs some share of mind, and it needs some attention now in order to bend that growth curve. So what specifically can you do? I'm going to share with you 8 suggestions of different tactics that you could take on if you were willing. And they kind of range from, I'm going to start with the lowest involvement or lowest intensity ones and work towards the higher intensity ones. Before I dive into that, I just want to point out that up in the upper right-hand corner of this slide, there is a link to our website where you can access a toolkit that gives you tips and templates for how you can do each of these things. For anybody following along on the telephone, it's also available on www.diabetes.ca/strategy, and it's under the Get Involved section, Tips for Advocates. So it's easy for you to get to, and hopefully easy for you to use. Please don't hesitate to reach out to us if we can offer further support. So some tactics that you can get involved by doing. We're going to be launching in the next week or two an electronic advocacy campaign, whereby people will be able to click through from a link on social media or in an email to an easy form where they can add their first and last name and their postal code, and an email to their member of parliament, member of provincial parliament, senators will automatically be generated, and they'll have the ability to choose from among certain template paragraphs, so you can choose which ones are most meaningful to you. You also have the opportunity to provide text of your own if you want. You don't have to, but if you want, you can. And then hit send, and your elected officials will receive an email that comes from you and speaks to them. And so they really, I've talked to a lot of members of parliament lately, they really get these letters and they read them and they hear them. So it's a really effective way for us to make the case for a strategy in Canada. While you're at it, you'll also be offered suggested social media posts, tweets, or Facebook posts, or LinkedIn posts that you can easily share and use to invite your networks, personal or professional, to join in the e-advocacy campaign. The more that we have, more people we have writing in, the more likely we are to get this over the finish line. You can talk to your networks, again, both professional and personal, about why you believe in Diabetes 360. And I see on the line here tonight a number of people who so generously devoted a lot of their time and energy over the past year to helping us create this strategy. You can talk to your networks about why this is meaningful for you and why you think that now is the right time for Canada to embrace this. You can send emails out to your networks. You can post on LinkedIn if you're aiming at a professional audience, on Facebook if you're trying to reach your family and friends. If you're going to a meeting or a conference, consider speaking about it. And the more that you get awareness up, the more voices that we have speaking up for this, the better. In that vein, you can blog or tweet your perspectives, and whenever you do, it would be great if you could use the hashtag Diabetes360 so that we can start to create a real online conversation. You can consider writing an opinion piece or reaching out to your local media outlet to share your story. Local media always love to hear from people in their communities who are grappling with issues, so they would love to hear what your experience of living with diabetes has been, perhaps, or caring for someone who does. And so consider reaching out to them and adding your voice to the sort of more conventional media outlets. Meet with your elected officials. You can contact them to ask to meet with them in their offices. You might also see them door knocking these days. And so reach out to them and tell them why you are calling for a diabetes strategy for Canada. Diabetes Canada will be holding a number of lobby days in the fall in various provinces and here in Ottawa on the federal level. And so consider getting involved in one of them. And I've provided a link that you can email us to find out if there's one near you. And if there isn't one near you, you can consider attending an event that maybe your MP is holding, a barbecue or what have you, or you could even hold your own to gather people together from your community who want to talk about a diabetes strategy and how it would help. So those are just some ideas. We are always at Diabetes Canada really happy to support you in any of this and to hear how it goes if you try any of it. So please don't hesitate to use the contact information in the toolkit to contact us. And I also offer you here on the last slide my email address for anyone who didn't already have it. Never hesitate to reach out to me with any way that I can help. So that ends the formal presentation. I have unmuted all of the speakers, but you'll need to just, if you want to ask a question, just press *6 on your handset, and then I'll be able to hear you. Any questions from anybody?
Cam?
Yes.
Can you hear me? It's Joan. Could you explain to advocates on the call, provincial advocates, why this would be important to their provincial elected officials, so that if they had an opportunity to talk to their MLA, whether it's individually or at one of their receptions, the MLA receptions, what's in it for our provincial government? Can you explain that?
Yeah, it's an excellent question, Joan. Thank you for that. I think that every province stands to benefit from taking part in the implementation of this framework, because right now provinces are sort of going it alone and trying to solve a really complicated problem each individually. If they can be supported by a common infrastructure of tools, resources, best practices that they can tap into and customize for the priorities and the realities of their province or territory, it can really make their job easier and help the provinces more efficiently make a dent in the problem we know that all of the provinces are struggling right now with not having enough resources, healthcare resources, to be able to meet the needs of their citizens. This is a way that we will achieve more with the resources that we have, and really start to ease the burden on those healthcare systems. So I think that the benefit for the provinces and territories of participating can be huge. And so I would encourage those of you at provincial receptions to ask your MLAs, would it not be helpful for you to be able to tap into a nerve center or central repository of best practice, and then take away what works for your province, customize and adapt it to your reality, and then drive towards the common goal of ending the diabetes epidemic in Canada? So I think simplistically, that's how I would answer that question.
Awesome, thank you. Can you still hear me?
Yes.
Okay, sorry, my phone is giving me problems. Okay, second question, if I don't want to take everything over, but just for readiness for our provincial advocates. So what can they recommend to their MLA? So they've talked about Diabetes 360, the benefits, what it can do for Canadians and for people living in the province. So what can they ask their MLA to do? So we've been in that position many times on different issues where the MLA is sitting across the desk or at the table and said, okay, I get it, awesome, it's a great idea. What do you want me to do?
I would like every citizen to ask their MLA to ask their provincial or territorial Minister of Health to send a letter of support for Diabetes 360 to the federal Minister of Health. I'd like to ask every MLA to get their government to support signing on to participating in this implementation, to this collaboration.
Mm-hmm. Awesome. Thank you.
Any other questions? Please remember to press *6 to unmute your phone if you have a question that you'd like to ask. Okay, well, I'm not hearing any more questions, so I will end the call, but I want you to all please feel free to reach out to us, to me personally, or to the links that I provided at any time with any further questions that you might have. I also would really welcome any feedback that you have on the strategy as I've shared it with you tonight, and I really hope to meet many of you and see you at our various events in the next few months. And I hope to be able to celebrate with all of you the implementation of this strategy in 2019. So thank you again so much for your time and attention tonight, and I wish you all a good evening.
Thank you.
Thank you.
Thank you.